my name is Natalie Polzen, and this is a presentation on the relationship between the microbiome and polycystic ovary syndrome. Hippocrates once said, quote, "All disease begins in the gut," unquote. Recent studies have shown that the intestinal microbiomes of women affected by polycystic ovary syndrome, or PCOS, differ from unaffected women in a predictable way, and that normalizing the microbiome leads to a decrease in symptoms. This knowledge could lead to new treatments to alleviate the suffering of women impacted by a difficult-to-treat disease. So what is polycystic ovary syndrome? It's a prevalent endocrine disorder among women, affecting 5 to 10% of women of reproductive age throughout the world. It has 3 defining features: hyperandrogenism, anovulation, and the presence of multiple ovarian cysts. This disorder can cause infertility, irregular menstrual periods, hirsutism, central obesity, and insulin resistance. Women who have it are at a high risk for a variety of health problems that can shorten their life expectancy. The symptoms of PCOS are caused by the excess production of androgen hormones by the ovaries. The etiology is poorly understood. Further studies are required to better understand the pathophysiological mechanisms that cause the syndrome. A chronic inflammatory process is one of the underlying causes that increases the severity of the disease. The degree of insulin resistance positively correlates with the level of inflammatory markers. The microbiome of the gut refers to the microorganisms that live inside the gastrointestinal tract. Humans and their microbiomes have a symbiotic relationship. The microbes aid in the function of the immune system, inhibit infections, and help extract nutrients from food. Studies in rodents have shown that the composition of the gut microbiome has a direct effect on body weight, and human studies have shown predictable microbiome changes that are associated with obesity. Research has shown that the composition of the gut microbiome has a direct relationship with sex hormones. They found that the microbiomes of male and female animals were similar until puberty, when the compositions radically changed. Studies on both humans and rodents have found a predictable relationship between the sex hormones and the diversity of the microbiome. The diversity shows a significant decrease with both an increased severity of PCOS symptoms and overall androgen levels. A human study found a 15% decrease in the diversity of the microbiome between healthy women and women with PCOS. This is a graph showing the types of common bacteria and their relative abundances in healthy women in comparison to women with PCOS. Researchers have developed a theory known as the, quote, leaky gut, unquote theory. They found that the disruption of normal gut microbiomes causes an increase in the permeability of the intestinal wall. They theorized that it is this increased permeability that worsens the severity of PCOS, as endotoxins produced by gram-negative bacteria in the gut can cross into the circulatory system. This leads to a chronic low-grade inflammatory process, activating the immune system and interfering with insulin receptors. This increases the circulating insulin levels, which then increases androgen production, worsening the severity of the disease. The current treatment regimen for PCOS are androgen inhibitors and oral contraceptives to regulate the sex hormone levels, and anti-diabetic agents to regulate the body's response to insulin. In 2016, researchers from the University of China conducted a rodent study to evaluate the potential benefits of alternative treatments. They tested the effects of probiotic supplementation and fecal microbial transplantation on mice treated with letrozole, a drug used to induce PCOS. They found that both interventions were beneficial in decreasing the symptoms of the rats with PCOS. In the 2016 letrozole-treated rat study, the PCOS rats were given a daily dose of lactobacillus for 2 weeks. After the treatment, the composition of the microbiome and the androgen levels of those rats were more similar to the healthy rats than to the untreated PCOS control group. In a similar study conducted on humans, women with PCOS were given a daily supplement containing 4 strains of lactobacillus for 12 weeks. At the end of the study, the women in the test group had a decrease in inflammatory markers and a significant decrease in weight versus the control group. Although more studies need to be conducted to further support this research, these results indicate that probiotic supplementation with lactobacillus strains is beneficial in the treatment of PCOS. The letrozole rat study also researched the effects of fecal microbial transplantation, or FMT. Rats were given a daily gavage of fecal samples from healthy rats for 14 days. At the end of the trial, the rats had decreased levels of androgens, more normal morphology of the ovaries, and a greater diversity of the microbiome compared to the control group. In another human study on obesity unrelated to PCOS, FMT was performed using a healthy lean donor on patients with metabolic syndrome. After the FMT, the subjects with metabolic syndrome had increased sensitivity to insulin. The study was not focused specifically on the treatment of PCOS, but patients with the disease often develop metabolic syndrome and have insulin resistance. Although PCOS was not the primary focus, it supports the benefit of FMT for PCOS patients who have developed metabolic syndrome. Although the causes of PCOS are poorly understood and warrant further research, the studies I've referenced in this presentation show the relationship of the microbiome to PCOS and could lead to new treatment options. This is a disease with a significant impact on the quality of life as well as lifespan, and current treatments manage only symptoms. They are not a definitive cure. The current research into probiotic supplementation and FMT as treatments for PCOS show that they may be viable treatment options in the management of this complex and debilitating disease, and they warrant further research. Thank you very much for watching this presentation. This is a topic I'm very interested in, as I was diagnosed with PCOS 10 years ago. The research I've outlined in this presentation could have a significant impact on both my quality of life and the quality of life of all the millions of women throughout the world that suffer with this disease.